Warm welcome to one and all. We pharmacy students from KMCH College of Pharmacy are here to give a small introduction about Quinolone antibacterial agent and to explain in detail about its structure-activity relationship. Quinolone antibacterial agents are a group of synthetic substances possessing in common an N1 alkylated 3-carboxy 4-pyridine ring fused to another aromatic ring, which itself carries other substituents. They are broad-spectrum bactericidal agents. These quinolones can be further classified into different generations. For example, the first generation quinolones are highly effective against gram-negative organisms such as nalidixic acid and inoxasin. As the generation of the quinolone progress, they become more and more effective against gram-positive organisms as well. For example, in case of second and third generation quinolones, these are active against Mycoplasma chlamydia species which are gram-negative and also against some gram-positive cocci. While in case of fourth generation quinolones like trovofloxacin, it is effective against gram-negative as well as gram-positive organisms and also anaerobic organisms. But unfortunately, this drug has been withdrawn from the market because of its severe hepatotoxicity. In gram-negative bacteria, quinolone binds to the DNA gyrase enzyme and blocks its activity, which impairs the DNA replication process. This consequently leads to bactericidal effect. In gram-positive bacteria, quinolones binds to the topoisomerase 4 enzyme and blocks its activity, which impairs the DNA separation process, consequently leads to the bactericidal effect. Now, let us have a quick look how these quinolones inhibit this DNA gyrase or topoisomerase 4 enzyme. So, once the DNA is prepared for the replication process, this DNA gyrase enzyme or topoisomerase 4 comes into picture and forms a complex called as DNA gyrase complex. Now, this is attacked by these quinolones and that leads to the formation of ternary complex. Quinolones selectively inhibit the topoisomerase 4 enzyme present in the bacteria while does not affect mammalian enzymes. This ternary complex, because of the quinolone scaffold, it can have a proper stacking interaction with the DNA, and because of this, carboxylic acid is involved in the chelation with a metal called as magnesium present in the active site of this DNA gyrase enzyme or topoisomerase 4 enzyme, and this substituent at 7th position is also involved in having a proper interaction with the enzyme, and that is how they are going to inhibit this either DNA gyrase or topoisomerase 4. Because of the inhibition of these enzymes, the bacteria are unable to replicate and that leads to the killing of bacterium. Now, let us discuss about the structure-activity relationship of quinolone antibacterial agents. The essential pharmacophore for activity is 1,4-dihydro-4-oxopyridine 3-carboxylic acid. The C3-carboxylic acid and C4 ketone are involved in the binding to DNA gyrase system. Reduction of 2,3 double bond or 4-keto group inactivates the molecule. Substitution at second carbon interferes with enzyme substrate complexation. Fluorosubstitution at 6th carbon produces two major effects. 1. It greatly improves antimicrobial property by increasing the lipophilicity of the molecule, which in turn improves the drug penetration through bacterial cell wall. Second, it also increases the DNA gyrase topoisomerase 4 inhibitory action. Example, ciprofloxacin, gatifloxacin. An additional fluoro group at 8th carbon further improves drug absorption and half-life, but it also increases drug-induced phototoxicity. Example, lomifloxacin. Substitution of methoxy group at 8th carbon reduces photosensitivity. Example, gatifloxacin, moxifloxacin. Heterocyclic substitution at 7th carbon improves the spectrum of activity, especially against gram-negative organisms. The piperazonyl group as in ciprofloxacin and pyrrolidonyl group as in moxifloxacin represent the most significant antimicrobial improvement. The piperazonyl group at 7th carbon also increases binding to CNS GABA receptor, which accounts for CNS side effects. Example, ciprofloxacin, gatifloxacin. Alkyl substitution on piperazine nitrogen is reported to reduce binding affinity to gamma aminobutyric acid, owing to reduce CNS side effects. Example, ofloxacin. The cyclopropyl substitution at N1 appears to broaden the activity of quinolone to include activity against Mycoplasma, Chlamydia, and Legionella species. Example, ciprofloxacin, gatifloxacin, moxifloxacin. Substitution of 2,4 difluorophenyl at N1 also improves antimicrobial potency, but agents with this substitution have been withdrawn from the market due to serious adverse effects such as hepatotoxicity. Example, trovofloxacin. The introduction of the third ring to the nucleus gives ofloxacin. Additionally, ofloxacin has an asymmetric carbon at the C3' position. The synous levoisomer such as levofloxacin is twice active as ofloxacin and 8 to 128 times more potent than rectus dextroisomer, resulting from increased binding to the DNA gyrase. Example, ofloxacin, levofloxacin. Now, let us discuss the summary of so far discussed structure-activity relationship of quinolone antibacterial agents. Positions 2, 3, 4 are involved in binding to DNA gyrase, which is essential for its bactericidal action. Hence, 1,4 dihydro 4-oxopyridine 3-carboxylic acid is the pharmacophore. Pharmacophore is a part of molecular structure that is necessary for binding with the target receptor or enzyme. Next, position 6 involved in the bacterial cell penetration and DNA gyrase affinity. Example, moxifloxacin. On moving towards position 7, involved in spectrum of activity and pKa. It is the key position. Next, position 1 impacts pKa value, drug potency and stacking. Presence of cyclopropane at first carbon improves the potency as seen in ciprofloxacin. On moving to position 8, involved in spectrum of activity including anti-anaerobic activity as in case of 4th generation quinolones. Example, trovofloxacin. Finally, position 5 impacts gram-positive activity. Quinolones are mostly prescribed for urinary tract infections, respiratory tract infections, endocarditis and meningitis, but these quinolones are associated with major side effects such as tendinitis, which is associated with the inflammation of tendons, and it is also associated with neurotoxicity that can damage your nervous system. Fluoroquinolones are also associated with nephrotoxicity, which leads to a damage of the small subunits that are present inside the kidney called as nephrons. Fluoroquinolones are also associated with the serious cardiotoxic effect, which leads to QT interval prolongation, and this can lead to a pathological condition called chemistry department, KMCH College of Pharmacy, and we thank all of you for your patient listening.